I'm so excited to be here today to just be listening and have been part of the presentation today, and the chat has been wonderful, and I'm excited I get to spend a couple minutes sharing with the group. I'm here today to talk about what we are doing at PAF, and particularly through and via the Patient Insight Institute to really incorporate patient insights into our work. And as we have heard and seen, the patient voice is so important. And Gwen, I'm going to do one more check. I switch slides on my view. Did it switch for you guys?
Yes, it's a slide that says patient centricity is becoming critical. Yes.
Perfect. Okay, good. So the technology is working. So now I can just focus on the content. So everything that I've heard today from, the patient voice, the sharing, the narrative, the health literacy concerns and the framing, I mean, it all really points to this idea that patient centricity really is becoming critical and central to not only care, but research and policy. And so we at PAF are really looking for ways to make sure that not only the work we do, but all of health and care really is informed by the whole patient experience. So we do a number of direct services for patients. We inform policy work. We do healthcare transformation and research projects. And at the heart of all of those, we try to really ensure that patients' needs are being met, but also patient voices, perspectives, and actual patients and caregivers are integrated into that work. And not just any patient. Something that I've learned through my time in this field is that often patients and caregivers that are picked for this work tend to look, sound, and think like the healthcare workers, the policymakers, the researchers that are advancing and leading the projects. And so really, we want and work to make sure that that patient experience is integrated, that is a very diverse patient experience, and typically by those who have been historically underrepresented. So I think that's a really important and key part of what we're doing at the Patient Insight Institute and through PAF. And I'm here today to just share a few different ways that we've been doing that. So I have to just acknowledge all of our collaborators. We launched the Patient Insight Institute in October of last year to really formalize the work that PAF is doing and has been doing in the space of patient engagement and research. And we've had a lot of wonderful support in projects with a number of different collaborators, and that list keeps growing. Central to kind of what really grounds our work is our Patient Insight Network. So we currently have a network of patients, and these are all patients that have been served by PAF. They are interested in becoming more involved in this work of being engaged in forming policy, care, and research initiatives. And they have a history of facing some sort of access or affordability challenge. And right now we're at 2,100 members. When we send out messages, this is a really, really engaged group. About 52% of them open our messages. And any of you that know about open rates and click rates, this is really, really high. And then we have members across the United States, across different diseases, across different ages, race, ethnicity, gender and gender identity. It's a very diverse group, and we're always looking to expand that diversity of experiences and perspectives. So this really is the cornerstone of the Insight Institute, so we can continue to get not only the depth of patient experience into these projects, but also the breadth of the patient experience, because everybody on this call knows if you've heard one patient story, that means you've heard one patient story, right? One patient cannot speak for an entire community. So our group really has shared that they They have experience doing this. About 41% have shared their experiences in a group. 24% really want to stay informed, but not necessarily actively participate in projects. And about 66% really want to inform projects via email surveys. So they don't necessarily want to be on camera, on boards, on groups. They're really just comfortable and have the capacity to do a little bit of a high-tech, low-touch engagement, which is great. And I think it really speaks to what we've been talking to today about meeting the patient where they are, pulling them in as their interest, ability, and really bandwidth allows. And I also think it's good not everybody wants to be on a board, because right now, if we had 2,100 patients that wanted to serve in a committee or on a project, we don't have that many partners right now. So, there's absolutely something for everybody. We've gotten a lot of great feedback, as you can tell from this quote. People really love to be included in projects. And I think our biggest challenge is convincing the researchers, the policymakers, the health system administrators, the health systems leaders that you need, want, and can include this patient voice in a meaningful way. And the Patient Insight Institute is really not only connecting patients with these projects, but also expanding the capacity of these partners to meaningfully engage patients and teaching how do you engage patients in a way that really integrates their insights and also can influence decision-making in projects. So we also have a group of experts by experience is their official title. They are the Patient Insight Institute's advisory committee. They are made up of a number of patients and caregivers, some from MPIF. Some of them may be on this call. I haven't looked at the entire list. I know a few of them are probably, and then some from our Patient Insight Network. And we've recruited them. We don't have all their pictures up yet. They're supposed to be sending me their pictures. So if you're on the call, that's a plug. And then we've organized this advisory body into two subcommittees, one really focused on social need and equity, and one focused on COVID-19 and the impact of the pandemic. And these experts by experience meet twice a year fully together, and then about monthly with the subcommittees. So in addition to the online survey work that we're doing with patients, we're pulling in patient voices to not only inform the projects we're doing, but also our strategy and kind of looking at what's on the horizon. What are we, what's being heard out in other spaces that we can't be in? And then are we really going the right direction? So this is a group of patients and caregivers that are, truly helping us build the plane while we fly it, but also helping us navigate and fly that plane. One more analogy we can just completely work on, right, Gwen? So one other thing that we also did, in addition to our Patient Insight Network and our experts by experience, we have built a COVID-19 learning community. So this is a group of patients, caregivers, and providers. Right now, they are working together to create and execute a patient-centered research agenda around the COVID-19 pandemic. We have over 100 participants. We have planned 4 workshops, 2 of which have happened. And we've created 2 educational resources that really help. One of them helps patients understand what patient-centered research is, so they're ready to partner with projects that come to them. The other one is more of an informational resource hub for COVID-19 to make sure that everybody involved in the learning community has the resources they need, the questions answered, and they're readily available on a website. So the learning community, we've held 2 workshops to really focus in on and understand what is happening in patients' world related to COVID-19 and the pandemic. When we did our first workshop back in December, we identified these 6 priority areas. And when we had our second workshop in March, what we found was that everything had changed. And everything with COVID-19 and the pandemic is changing quickly. And so right now we are in the process of updating that priority list and trying to understand how and why things are changing so quickly, and pull in researchers that can help support us and partner with us on some of these priority areas that have been identified. So I just really want to put in a couple, take a couple moments to talk about the impact of the work that the Patient Insight Network and the Experts by Experience have had on projects already. We have only really been up and running with a couple of those groups for about 4 or 5 months now. The Patient Insight Network has been active for about little less than a year. So in that short time, I feel like our patients have really made a huge difference in the work that we're doing and the work of other researchers. So a couple real life examples, and Gwen and her team asked me here today to provide kind of concrete examples of how have patients and caregivers really changed and impacted projects that they've worked on. So one thing, we are partnering with Siren. They're a social need research group out of UCSF, the University of California, San Francisco. And they were going to, a couple researchers over there were going to do interviews with patients around their adverse childhood experiences and their social determinants of health. And they had an entire long interview guide created. And they asked us if our Experts by Experience could review that interview guide. And so, of course, we said absolutely. We had a meeting where we went over the project with our advisory committee. And then that group reviewed the interview guide on their own, sent in feedback to the researchers, and gave them some really, really good insights on how they were wording questions, the order that the questions were going in. Ask them critical questions about, why are you asking this question? It may be difficult for somebody to answer. Certain questions they may not understand. And so the patients that we work with really gave great advice to researchers about what it would feel like from a patient and caregiver's perspective to be part of this research study and sit in one of these interviews and be asked these questions. And with that feedback, the researchers are in the process of revising the interview guide to really ultimately make that project more successful, to get the information they want, and do that in a way where the patients, community members, caregivers that they're interviewing are more comfortable and have a better experience. The second piece that we have done recently was, we were a Harvard researcher looking at a interventional study for cardiovascular disease reached out to us and wanted to know if we would be willing to endorse his study because it's for focused on low-income Americans, and they needed a checkbox patient, right? Like, hey, patient advocates like this. So I had a really, really good call with him, and I said, no, we're not going to checkbox your project and give you a letter of support on our fancy letterhead just so the NIH would approve your study. But what we can do is we can partner with you on the study. You can build in a patient engagement arm where we actually have patients involved in the planning, in the design, in the recruitment, the execution of your study objectives. We are happy to provide content experts, engagement expertise, skill building for your research team, and we will be a partner. And he loved that idea. Again, somebody that knew what the team and the project needed, but didn't have the skills or the capacity to do that work, or didn't even know how to write it into his project. And so we wrote that into this cardiovascular, this heart study. And then last minute, he said, well, I asked all these clinics if this would be, in these studies, there's this feasibility, and you have to prove that clinics will implement your study. It's feasible. It can be successful, and so the NIH would fund it. And he got a whole bunch of feedback from clinics, from researchers, and I asked him if he had gotten any feedback from patients. And he said he didn't think of that. So I asked him, so when is this grant due? It was due in about 2 weeks, which any researcher on the call or anybody that's been involved in research knows you can get very little done in 2 weeks. But because we had our patient insight network, because we had such an active group of patients that were ready and willing to provide some input very quickly, we were able to put out a study to our patient insight network and ask them very specific questions about a study. If study A, did this, would you be interested? Would you be willing to be part of it? So this idea of understanding the feasibility and the acceptance from a patient perspective, still very theoretical, but at least kind of testing it with patients before it was submitted. We had about 250 respondents in 48 hours, and he was able to put that piece as well as the engagement piece into that project. And what I think, why I get so excited about this project is because in a very, with a couple phone calls and in a very short time, we were able to influence a large national multi-site project to include patient engagement. And we were also able to get him some real-time patient feedback before he even submitted the project, which I think demonstrates it's not as hard and as scary as some researchers think it may be, right? And so I guess we did a little, teaching. It was an N of 1, but I'm excited to, fingers crossed that project gets funded and we can continue to be part of it. But I was really excited that we got to kind of pull one more researcher over into the engagement side. The last piece that I want to highlight is our COVID-19 priorities and research agenda. And I mentioned it a little bit earlier, but really one other thing that we're doing, not just around COVID-19, but a lot of areas, is that when we are getting patient insights, patient data, when we're hearing about things out in the field, out in the community, and then we'll bring it to our group and we'll say, we're hearing this, what do you think of it? All of these topic areas bubble up. And as everybody on this call knows, patients hear and see things, communities hear and see things differently than researchers, policymakers, health systems leaders, than what they hear and see. And so any way that we as Patient Advocate Foundation and Patient Insight Institute can really push and influence researchers to have a priority that better aligns with the priorities of patients and caregivers. That really is our number one goal. And we're doing that around COVID-19, but we also have plans to do that around a lot of other topic areas. So I will leave everybody with those few examples. I hope it was fun and enjoyable to see and hear some real world examples of how Patient Advocate Foundation is integrating patients into the work that they're doing, the decision making, and into our partnerships. And please feel free to drop in the chat any questions or reach out to us if you want to learn more.